100 days. What if we could make a safe and effective vaccine against any virus in 100 days? We could outpace emerging infectious diseases, and we could prevent future outbreaks from spiraling into a pandemic. We would avert millions of lives lost. We would prevent the economic losses of trillions of dollars. And we could make pandemics a thing of the past. I'm Melanie Saville, and I head Vaccine Research and Development at CEPI, one of the organizations leading the global response to COVID-19. I'm sure you'll all agree with me that the world has really benefited from the innovations of vaccines in COVID-19. In fact, the first COVID-19 vaccine was approved for emergency use in December 2020. That was just 326 days after the virus was identified. With this process usually taking decades, its rapid development and approval was unlike anything that had been seen before. It's a shift to a few hundred days is really a triumph for science and something that we should all be proud of. But the real question is, we could do even better. What if we could shave 2/3 of that time and make it in 100 days? Known as a 100-day mission, this is an ambitious goal which lies at the heart of what CEPI's plan is to prevent pandemics in the future. We've also got champions, the G7, the G20, and also heads of the pharmaceutical industry. GSK, Pfizer are all behind this, and today I want to inspire you to join on board. To begin with, though, we need to look back at the last couple of years or so and what has already been achieved to really understand how we can make this 100-day goal. And CEPI, as an organization, we were quickly alerted to these mysterious cases of pneumonia in Wuhan right at the beginning of 2020. I remember very well my first day back from the Christmas holidays. It took 2 minutes for my boss to come up and say, "Melanie, we have a problem. It's a coronavirus." That very day, we had discussions with the World Health Organization and others. And by the end of the day, we knew we needed to respond. We announced our first partnership agreements on the 23rd of January 2020, when there were only 581 cases worldwide. Having research programs and partnerships already in place for developing vaccines helped us really to move forward very rapidly. For example, the data that was already generated from the Oxford MERS project, another coronavirus, could be used to rapidly pivot that program to develop a COVID-19 vaccine. And another instance, working on the decades of research from mRNA vaccines, we were able to explore the full potential of mRNA and its ability to move very rapidly to produce huge numbers of doses of vaccines. And we moved from doing vaccine development in a sequence to allowing developers to manufacture vaccines at the same time as gathering the clinical data, so that millions of doses of vaccine would be available in the event that those vaccines were successful. Now, if you come back to today, as of today, there are nearly 12 billion doses of vaccine that have been rolled out worldwide. That includes 1.5 billion doses that COVAX, the institutions that I'm part of for vaccines for the world, Moderna, Oxford AstraZeneca, and Novavax, there are 3 COVID-19 vaccines that have been licensed that CEPI, my organization, has funded. Yet, despite this revolution, we do need to do better. And the real question is, to get to 100 days, if we had developed a COVID-19 vaccine in just 100 days, vaccine may have been available in April 2020, when there are only 2.3 billion cases, as opposed to December, where there were already 68 million cases reported. Faster vaccine development would not only have saved many of the millions of lives lost, also the economic challenges of the pandemic, but also potentially even limiting the emergence of variants. We must use these lessons learned from the pandemic for our 100-day mission. COVID-19 is not the first pandemic of the 21st century, nor will it be last. So we need to prepare for a disease X emerging at any point. We have seen recently the re-emergence of Ebola in the DRC and fast-paced spread of monkeypox right now. So we must move quickly. So how can we get to our 100-day mission? In an outbreak, we have to combine things like early disease detection, diagnosis, social distancing, with developing a vaccine in 100 days. And this will give the world a chance to extinguish a future pandemic. While this goal to many of you will seem really quite far-fetched, the best way to approach this is really to break it up into bite-sized chunks. So I have 4 key areas that I think we all need to work on. So area number 1, shorten every step of the vaccine development process. I've already uncovered some of the ways that this has been done through COVID-19, from the use of innovative technology, the use of manufacturing doses while you're still developing vaccines and doing the clinical trials. If we actually combine all of the best-in-class work that has been done for COVID-19, we believe in a similar situation, we could already remove 2 months from that process. And in fact, we need to look to Formula One for some inspiration as to how to do this. The racing car enthusiasts amongst you will know that pit stops, when a driver stops for fuel and tire changes, used to take an awful lot longer than it does today. And thanks to incremental improvements over the years, it now takes just 2 seconds. Combining the new technology with perfecting every single step of the process. And I found a clip that I think illustrates this well.
Tires are changed at last. A crewman polishes the windshield as Holland moves away just 67 seconds after he stopped.
We do believe that we can use this same process for vaccines. So number 2, complete as many pieces of the puzzle before the next virus emerges. COVID-19 did not come out of the blue. Due to the work of many working on other viruses, closely related viruses that were other coronaviruses, this really helped move things along really quickly. We need to replicate the work that was done on coronaviruses before with all of the virus families that infect humans by developing virus family libraries, vaccine libraries, so that when a new virus emerges, we can take those vaccines off the shelf and rapidly adapt them to the new virus so that we do not have to start from scratch. Number 3, build vaccine manufacturing capacity closer to the outbreak. If every region of the world had had rapid manufacturing capacity for a vaccine, for the vaccines that is needed, those vaccines would not have been, they would have been delivered much more quickly. What we actually saw with COVID-19 was significant delays with importing vaccine into countries without those capacities, also being put at the back of the queue. If every region had the manufacturing hubs that could manufacture the vaccines it needs close to the outbreak, that would dramatically reduce the amount of time to get vaccines to people. And then number 4, shift the way we do clinical trials and regulation. We have to face the fact that we might be in a situation where we have a highly lethal and highly transmissible virus, where it might be appropriate for us to emergency authorize a vaccine before you have any efficacy data, and rather use the time after that to generate the efficacy data. In these sort of circumstances of a deadly pandemic, this may stop the pandemic and outweigh the risks. Through the vaccine libraries that I mentioned, we would be already gathering safety data in advance and gather a wealth of data on the vaccine platform. We then use that 100 days to gather additional data that the regulators would require. A similar approach is already used every year with an influenza vaccine, and we believe that we can replicate this for future pandemics. Now, everything that I've said about the 100 days is meaningless unless it's associated with access. We have seen the dreadful inequity in the world in this pandemic, with many countries waiting months and months for vaccines. Achieving equitable access to meet the 100 days means having the tools available at the source of the outbreak. So we must continue to strengthen the public health systems and ensure that governments and partners are thinking global rather than national. Of course, achieving 100 days won't be cheap, and we will need many funders and many partners to join on the mission. For our part, CEPI has a 3.5 billion plan, and we've already kick-started research to move the needle. Comparing this to the trillions of dollars that have already been lost in COVID-19, that is exactly what we need to do. We must not let the lessons learned from COVID-19 pass us by, and we must use all of our lessons learned to put them forward to the 100-day mission. We can reduce epidemics and pandemics if we want to. We do have the tools, we have the agenda, and it's time to take action.
100 days. What if it took 100 days to make a safe and effective vaccine against any virus? We could outpace emerging viral threats and prevent future outbreaks from spiraling into pandemics. We could save millions of lives. We could avert trillions of dollars in economic losses. And we could make pandemics a thing of the past. This is not just a pipe dream. This future is now within our grasp. This is CEPI's moonshot, an Apollo mission for the modern age. While COVID-19 has brought the world to its knees, it has also sparked a scientific revolution. CEPI has a $3.5 billion plan that can unite the world and unleash the power of science against emerging infectious diseases. CEPI has a plan that'll help connect global surveillance networks to detect new viruses as they emerge. A plan that will create a library of prototype vaccines against viral families known to infect people. A plan that will bring to life rapid response technologies to be deployed against viral threats. A plan that will transform how we create, develop, and manufacture vaccines, and make them available to the most vulnerable people. CEPI has set its sights high, but together we can make this a reality. We must act now. Join us to make this 100-day goal possible. Join us to end pandemics forever.
Thank you.